could I ask us to recognize these true champions of health equity? So we move into a question and answer session. I'm remembering the words of that I hear from Dr. Jandel Allen Davis, who works for Kaiser Permanente in Colorado, and part of her job is to supervise community benefit. And she talks about philanthropy as having three legs: time, talent, and treasure. And so I'm asking you as a group to not look at the philanthropic world just through the treasure lens, bringing dollars to the table, but I think what you've really heard is the other aspects of how these remarkable individuals spend their time in mission-driven work to drive health equity forward in their community. And the talent and the knowledge that they bring forward is, I would say, often more important than the treasure and the funds that we bring forward. So I thank you for that work. I'm going to start off with a question. You all have in your packet information and materials that came from the National Academy's work, Communities in Action, Pathways to Health Equity. And one of the real focuses of that report is multi-sectoral work. That is, as Dolores said, it takes a village, and there are three parts of the stool. So I want to ask the first question of each of you: how do you approach that multi-sectoral collaboration? How do you reach out to the business, government communities to make sure that we're kind of working together and achieving kind of Dolores's vision of this almost seamless multi-sector integration? And what are the challenges to people in the audience and to you and your organizations?
Well, I'll start with, can you hear me? Is this on? With an example, when we did a blueprint for health, this was when the Affordable Care Act was first implemented. And we were trying to put together, again, this multi-sector, multi-field advisory committee to do work over the course of a year and a half to come up with an actual plan to implement it. So first I went to the advocates and said, okay, folks, we're doing this. We'd like you to be involved. And they're like, well, of course we'll be at the table, but we don't want to have anything to do with government. I'm like, okay, well, this is where we're going to meet and hope you can join us. Then I went to government, and their response was the same. Well, we'll be there, but we want nothing to do with those advocates. I'm like, okay, same thing. No one wanted anything to do with business. Well, they all came because they didn't want to be left out. They all worked together, and they came up with this outstanding plan that really, I think, was a true blueprint. And then there was an impasse, and they're like, well, we just don't agree on this. We can't go any further. I said, okay, well, we're just going to agree to disagree. And we wrote up a whole section on those areas that we didn't agree on, which was about 3% of the whole report. Everyone was fine with that, and we moved on. So I think the moral of the story is that you have to invite everyone. If you don't invite them, how can they come? And that they saw themselves that there was such synergy, and it was so much more impactful that they did, in fact, come together in that way. So they were all happy with the results. And you just have to be pervasive and persistent. And, use a little, I'm a social worker by training, use a few social work strategies to get them to work together.
And go ahead. No, you please. No, I'll do that. For Appalachian Community Fund, we started with quite a broad funding umbrella, I would say. We began working very closely with a New York trust fund, and one of the challenges, I would say, and this is probably no surprise, is sustainability. We found that the more we relied on those outside funders networks, the more we were running out of money to provide for our communities. So we evaluated the situation, and we shifted away from the larger funding networks. We are still a part of the Appalachian Funders Network, but we've switched our funding to a more community level perspective. We do things called concentric giving circles, and that's been our latest funding push, where individuals from the community actually say, I'm really invested in this topic. I'm going to start a fund specifically for this topic, and any money that folks put into it, that goes directly toward fixing that issue. We have concentric giving circles around LGBTQ issues, race issues, again, all of those social determinants. We kind of embody all of that. And we're finding, surprisingly, that the sustainability that we've had in the past year and a half has really improved by incorporating those giving circles. We've been able to provide more tailored grants. Right now, we're doing a technical assistance program for our 30th anniversary, where we're providing $33,000 grants to applicants who need technical assistance. And, you know, $3,000 doesn't sound like a whole lot, but when you're talking about a social movement in eastern Kentucky that can't afford a computer to data mine, that means all the difference in the world to them. So we're focused on shifting those funds to small grants that make large impacts.
And I'd like to say very similar, excuse me, to what Ashley just said. A lot of our work has taken place in approaching organizations and individuals, and the other way around. We approach organizations sometimes, and oftentimes they approach us. I think that's a very critical piece of it. Initially, when we were started, which we're only about 13 years old, but we were always impressed that one of the universities wanted to come and work with us. And we'd never really thought about approaching universities or even the governmental sectors to come and work with us. So once we learned and saw our own value, we approached actually the Alabama State Council on the Arts and said, one of the things that we can help you do, because you're a statewide entity, is we could help provide you access into these communities that you aren't readily serving. And until we recognized our power, we didn't know to do that. And then there were these rural communities that did not have access or exposure to the arts. So that gave us an opportunity to really stretch our wings. But we had to realize that love really was a two-way street. So for as much as we could approach others, others could also approach us. But we also had to work diligently to build our credibility so that others saw us as worthy partners.
I'd like to add on to that just a little bit if I could. With Appalachian Community Fund, similarly to Dolores's group, but different in the same way, we have a board, and then we have community level folks in each of our states. The board is made up of individuals from each of the states in Central Appalachia. And we also pay very close attention, like you all, to partner with those universities. In West Virginia, we have a very strong collaboration with Marshall University. And of course, in Tennessee, we have a very strong partnership with East Tennessee State University. So we find that not only is there funding available to those organizations through various routes, but the information that we can exchange makes it a very, very valuable partnership.
Thank you. George?
Yeah, George Isham, co-chair of the Roundtable on Population Health Improvement and a senior advisor at Health Partners in Minneapolis, but I'm also a resident of New Mexico in Santa Fe. There's a theme that runs through this panel, and I really appreciate each of your presentations. Thank you so much for doing this. But there's a theme that I pick up that runs through this panel. Starts with the black belt presentation, taking what we have to make what we need, sort of a self-reliant sort of ethic, which I admire, but also which speaks to the fact that you cannot rely on others or established institutions and power. My words, not yours. In Appalachia, one of the points on your slides was where government and industry are accountable for human needs without exploitation of people and their health, implying that government and industry is exploitative of the people. In other words, another self-reliant sort of theme. And then lastly, in New Mexico, I'm always puzzled by New Mexico, particularly the majority-minority point that you make. New Mexico stands 50th in education, I believe, close to that among the states in the low end. It's also more depressed in terms of the economic recovery from 2007 as compared with all the states around it. And yet it's a majority-minority state. And I'm wondering why that doesn't translate into governmental and institutional sort of activity that would address some of the fundamentals that in education and social factors that might lead to a more robust state. So there's a theme here that just puzzles me about institutional power and governmental power and the efforts that you're trying to do in terms of create good in your state. I wonder if you could help me understand that a little bit. And so I think if we understood that issue, we could perhaps develop policies to address some of that.
I'll start with the Black Belt region. Most oftentimes, there are definitely opportunities for ways to partner and to do work in the region. And I think whether it is at the Black Belt or in Appalachia or in New Mexico or in the Delta or other areas of the nation, but because it requires work to be done in a different type of way, I think most times folks will shy away from it. And it is definitely very hard work, and it must be intentional in being done. Most times that does not always happen. And so I think while we talk about the foundation and our ability to take what we have to make what we need, we also discuss the opportunity to forge a collective stream of giving, because we realize that together we can do so much more. So alone we get to move from point A to point B, but together and collectively we can move from point A to maybe point Z. So there are definitely opportunities, but I think that they've not always been recognized nor taken advantage of. And to be honest, I think it's been easier sometimes to sit and do nothing in areas. I attended Leadership Alabama, our kind of premier leadership program, and I heard an individual say, as we talked about many of the challenges, he said, well, why won't all the folks from the Black Belt just move to the city? And I said, well, that's the dumbest answer I've ever heard. But in all honesty, there are individuals who think that, not really giving any consideration to the amount of love, respect, and pride that those of us who live there have for our communities and our ability to shape and to give us credit for having the wherewithal to help shape and frame what we need. There's an African proverb that says to do something for us instead of with us does nothing for us at all. And I think that pretty much sums up the way we do our work.
I'd like to jump off of Felicia if I can, because we have a lot of similarities in those issues. And yes, I would agree with you. That is a pretty bold statement that we make in our vision. But it's the truth, and we believe in effective communication. If you look at the Appalachian region, I mentioned a little bit the coal industry. But outside of that, looking at how the coal industry touches other industries in the area, you look at railroad workers and their retirement funds being on the auction block for Social Security backup. You look at black lung insurance and the issues surrounding that. And it's not that hard to see why there's a distrust against corporations and government in Appalachia. It's very deep-seated, and it's really a struggle to get past. So what we've decided to do is, instead of framing the social movement around fighting the government, which is it's just constantly an uphill battle, we've decided to, again, empower our communities to stand up for themselves and go to the government and these corporations and say, listen, we're here in numbers. You're going to have to pay attention to us at some point. And that type of empowerment is what brought me to Appalachian Community Fund in the first place. Being from Eastern Kentucky, my dad was a railroader and my entire family were coal miners. And I was like, what are we doing with this drinking water? What are we doing with these diseases? And you can imagine the turmoil that I was up against alone. Then I found other people that were like-minded and had the same struggle as I did, and it was just night and day. I had an avenue, an outlet for my frustrations, and I had a path to change, and that's what really made the difference.
And I'll speak to the 2 points that were made. You know, one in terms of the resourcefulness and the resilience. I'm a grant writer, for example. We're a private foundation. It's almost unheard of. In fact, I don't know another private foundation that writes proposals and gets funding. We have gotten funding from Kellogg, Northwest Health Foundation, Robert Wood Johnson, and you know, no one told me I couldn't. So it's that kind of attitude again, right? And we've been successful. We've been able to leverage those fundings, those resources to collaborate with ours and to advance our mission. In terms of the second point of where New Mexico ranks on different scales and how does that correlate with majority minority, that's a complex issue, and a couple of, and I've been asked that a number of times, and I think part of it has to do with values. For example, I'm the first from my family to get a college degree. I would say maybe 1% of my family knows I have a doctorate and a master's. They don't care. What they care is if I'm a good person, if I support the community, if I participate in the community. It's a different value. So I think that's part of it. I think another has to do with historical oppression. I'm from Espanola, which is, by some people's definition, a very poor community, predominantly Hispanic. When one time one of my kids went to school in Santa Fe and came home with the book of Espanola jokes. How does that impact our children? How does that impact people in a community? So there's, you know, and I look at my Native American family. One of my granddaughters and grandsons are half Hispanic, half Native American. I remember one place I was working, I was second in charge, and the boss left and said, "Okay, Dolores, hold the fort." I thought, what's wrong with that? And I used to say that. I don't say that anymore. What does hold the fort mean? Against who? The Native Americans? When it was their land to begin with? So a lot of it, again, is that historical oppression, your perspective, how you frame it, and you know, I'd love to have a conversation with you about this, but I have a lot to say about it.
Yes, sir.
Dolores, thank you for just saying what I wanted to say, but I didn't know how to frame it. We cannot change our communities until we look at structures and institutions that have created the disparities in our community. We have to look at institutions of power and privilege and place and race in order to make a difference in our community. I appreciate what you just said. I'm Gregory Townsend. I'm a health administrator at Jefferson County Department of Health in Birmingham, Alabama. And I want to commend each of you for the great work that you are doing to improve health in your communities. You really are setting creating a model that can be shared around the country. I just want to commend you for that. Secondly, there are three things that I feel I wanted to share with the group today, with people all over the country today. In order for us to leverage opportunities for improving health, we need three things. Number one for me is building sustainable relationships. Building sustainable relationships. Felicia, I think you said that in so many ways. And in order to build a sustainable relationship, we have to build those relationships with our leaders in the public and private sector. We can't be afraid of them. We have to build relationship with decision makers, our politicians, and the people who need the help most. We need to build relationships with them on the grassroots level, on their terms, in their communities. The second one is we need to share resources and responsibilities. And what I mean by that, we talk about sharing resources and responsibility. We're talking about public policy, evidence-based practice and programs, and building social capital for gaining a collective impact by building a collective identity in communities. We have to think the same. We have to say the same things about the disparities that exist in our community. And then finally, we have to support research and academia. You know, a lot of people don't understand the data. We don't need data. Why are you coming with all these numbers? They don't understand them, but we need the evidence. We not only need evidence, we need action. We can research, but if there's no action behind the research, that doesn't mean anything. And the next component of that is evaluation. We need to make sure our programs and things that we put together have been evaluated properly so that we are doing the things that we say that we're going to do. And then finally, one thing that we don't like to talk about is accountability. Holding people accountable for the things that they say that they're going to do for our communities. That's all I have. So thank you for the work that you're doing. Thank you.
Octavio?
Well, there's not a response to that. That was a long list and all right on. Thank you, Ned. And also, I want to thank the panel along with everyone else, because I think what you're really showing is a strength-based approach to how you are actually handling the issues in your communities. Within that context, though, Octavio Martinez Hogg Foundation for Mental Health, University of Texas at Austin. The Hogg Foundation over many decades has also done faith-based initiatives, because we have recognized that's a really key component of our communities. And that's not anything that someone has mentioned yet. And I'm just wondering, from the panel, I'd like to hear what's your perspective on including faith-based organizations, and have you done any projects and/or what are your thoughts upon that? Because I think it's a key component of spirituality, means a lot to a great deal of our populations, especially in rural America, and it's an untapped resource, thinking about it from a strength-based approach.
We have in the Black Belt region, we've worked, I think, from day one very deeply with our faith-based community, and we've most recently finished a project working around young men and boys of color, where we've embraced our faith-based community, and not just working only with boys and men of color, but across the board throughout our region. And we found in most of the work that we do, we've had to really involve the faith-based community. We were just talking earlier today when you got churches on every corner all around the way, and the ability to influence, you know, large numbers of folks in the communities, we've considered it very valuable. We've had to use some different approaches sometimes to get the faith community involved, but it's been worthwhile and yielded really great results for us at the end of the day. And they've become a part of our board. They've served on committees with us, so they see themselves as a part of the infrastructure of the Black Belt Community Foundation.
Thank you, Felicia.
I can think of a couple of different ways. From an East Tennessee State University perspective, I've worked very closely, interestingly enough, with the Tennessee Department of Health. And we have created a partnership between faith-based communities and the Department of Health in Tennessee in addressing substance abuse issues with faith-based approaches. We know that, just like Felicia said, churches are a cornerstone in Tennessee, and so what better resource do we have to tell folks that, number one, it's okay to be an addict and still attend churches. Number two, we can provide you with resources through your faith that are going to help you through this process. So we've partnered in creating support groups as well as creating faith-based AA meetings, things like that, to incorporate that faith-based component into their recovery. In terms of Appalachian Community Fund, it's vast how we incorporate faith-based institutions into our work. I would say that about a third of our grantees are faith-based institutions who are doing work within their communities, whether it be driving patients to medical appointments, whether it be putting together a schedule to make sure that the community has dinner for a week. Those types of things are very important to us, and again, the stronger we can make those relationships, the more allies that we have to fight the issues that we're fighting.
Thank you for your question. We address it in both philosophically and structurally. So, for example, some funders will not do a grant to an organization that is not a 501c3. And many faith-based efforts are not necessarily incorporated or have their IRS. So we encourage and we support those kinds of proposals through fiscal sponsorship. The other way is when I talk about valuing diversity, I'm not just talking about ethnic, racial, geographic, and other, but I'm talking about diversity of thinking. And so we, ensure that we have different opinions, including faith-based opinions, all kinds of opinions on our board, our CAC, and our staff. And I think that goes an awful long way, and that's what I referred to earlier, is that we've institutionalized these practices and policies related to health equity.
Thank you.
Our final question. Thank you.
Good morning. I'm Megan Hodge. I'm just a recent graduate from college, so excited to be around you guys. I want to ask Mr. Loris. I actually just moved from New Mexico about 2 months ago, and I know there's Pueblos out there, so were you able to get into those Pueblos and get to those people? Because I know they have really bad disparities out there as well.
Thank you. New Mexico is about 10% Native American, which seems like a small percentage, but it's probably one of the states that has the highest percentages. And where I'm from actually is surrounded by Pueblos. We have tribal or Pueblos, we have Navajo Nation, Mescalero Reservation. So just like any other culture, there's a lot of diversity just within the Native American community. One of the ways that we, again, stay true to our community self-determination is when we receive proposals, and we actually get a lot of proposals in terms of serving tribal government or tribal communities, we require that they have a letter from the respective government, whether it's the governor or the president of the Navajo Nation, whatever. We require that that be there because it's been our experience that a lot of people that are not from those communities, again, want to go in and provide services that may not be needed or may not be wanted. So we stay true to that value. The other, because we don't fund government, we don't fund tribal, county, state government, is we, again, allow those types of requests for funding to come to us through a fiscal sponsorship. So we have created, and we encourage them, if they do want to partner with us, to do it through that type of a fiscal sponsorship, so we're not funding government, but we can still collaborate. Thirdly, we reflect, again, Native American is built into our bylaws, that we have certain representation, so we have representatives from Native American groups on our board, on our CAC, and in everything that we do. So I just want to reiterate that everything we do is pervasive, it's not marginalized, it's who we are, it's what we do.
So I have the lunch announcement, but before I give that, let us one more time thank our panelists for their treasure and talent and time. Thank you.